Lebanon right now is at a decisive moment in the evolution of its social protection system. After years of successive crises and coupled with the financial and economic collapse, deep structural weaknesses have been exposed in an already fragmented and exclusionary systems. All of these shocks have intensified poverty, they've widened inequalities, and they underscored the limitations of donor-dependent programs. They've also revealed a fundamental and important truth, which is that preparedness for crises and shocks requires a universal, rights-based social protection system already in place before these shocks happen. And so, in response, and in an effort to sustain the momentum of recent legislative and policy advancements, the International Labour Organization and the Arab Reform Initiative, with the support of the European Union and the United Kingdom, have convened a national policy dialogue series on promoting universal social protection in Lebanon. Held in Beirut over the span of several months in 2025, and in partnership with the Human Rights Watch and Amnesty International, this dialogue series created a multi-stakeholder space to help reflect on challenges, assess progress, and to identify actionable solutions and policy recommendations. The series addressed 3 priority areas, each of which had their own dialogue within the series. The first was on the sustainability of Lebanon's social assistance system and linkages with humanitarian aid. The second was on the implementation of the new pension scheme under Law 319, and the third was on recovery from a failed health financing system with pathways towards universal health coverage. Each of these dialogues in the series brought together a multi-stakeholder group of people, including policymakers, academics and experts, civil society, labor unions, international organizations, humanitarian actors, and other representatives. And the dialogues were divided into 2 sections, the first half on a high-level panel discussion, which was then followed by a technical roundtable, which ensured that both strategic and operational technical perspectives were addressed. The outcomes of these dialogues have been consolidated in our report titled Towards an Inclusive, Integrated and Sustainable Social Protection System in Lebanon. This report highlights the key takeaways from these dialogues, provides an analytical and comprehensive background on each of the priority areas, and provides a detailed and comprehensive policy recommendation and action plan, helping pave the path towards reform and implementation. The report emphasizes one central message, and that's that Lebanon must move beyond fragmented programs and beyond parallel humanitarian responses towards an integrated, rights-based, and sustainable universal social protection system. Some of the key policy directions we recommend include institutionalizing governance and coordination across ministries and agencies, building fiscal space and ensuring long-term financial sustainability, embedding humanitarian assistance within a nationally owned shock-responsive framework, and strengthening data systems, transparency, and accountability to rebuild trust. Lebanon has already taken important steps and made progress. The adoption of the National Social Protection Strategy, the launch of the National Disability Allowance, the consolidation of social assistance programs, and the passage of Law 319 all mark progress. And yet the central challenge remains implementation. As the dialogues and the report emphasizes, bridging the gap between strategy, legislation, and execution will be essential for building a system that is shock responsive, that can protect vulnerable groups, and can help restore the social contract and trust. And so if Lebanon can realize these reforms, it will move closer to fulfilling the vision of a universal, equitable, and sustainable social protection system, one that not only protects people from shocks, but also, and equally as importantly, rebuilds the social contract and strengthens the foundations for long-term recovery.